With 546 million people, East and Southern Africa's reproductive health challenges are vast. Maternal mortality and morbidity, HIV infection, low contraception use, early marriage, teen pregnancy and gender-based violence, humanitarian crises, underpinned by gender inequality. Within this context, UNFPA East and Southern Africa Regional Office works to improve the lives of women, adolescents, and youth in 23 countries in the region. It focuses on providing integrated services, empowering adolescents, advancing gender equality, linking data to action, and ensuring dignity and reproductive health in humanitarian crises.
For UNFPA in this region, we work in 23 countries. In 2014, we had a volume of resources in support of these countries to the tune of 183 million. And with really 1,000 very dynamic staff, we're able to do quite a bit in terms of guaranteeing sexual and reproductive health and rights for the people of East and Southern Africa, and particularly for the adolescents and young people.
UNFPA supports countries in the East and Southern African region to strengthen linkages between sexual and reproductive health and HIV policies, programs, and services. This is an approach that makes good people sense, as it benefits clients and service providers alike and can improve the cost efficiency of service provision. UNFPA supported government efforts to reduce maternal deaths through stronger midwifery services, improved emergency obstetric and neonatal care, and programs to treat obstetric fistula. It has built the capacity of 28 national partners and program implementers from 18 countries to scale up maternal death surveillance and response systems. Governments in the region are taking bold steps to increase demand for and access to voluntary family planning. UNFPA has been working with governments to increase their ability to procure commodities such as condoms and contraceptives and make sure that these reach those who need them most. UNFPA, in partnership with UNESCO, supported advocacy, implementation, monitoring, and evaluation of the East and Southern Africa commitment on comprehensive sexuality education and youth-friendly services in 2014. Under the commitment, countries are scaling up comprehensive sexuality education for young people. Public schools and other institutions cover topics such as sexuality, gender equality, prevention of sexually transmitted infections including HIV, relationships, and sexual and reproductive health and rights. Countries are also working toward making health systems more tuned to the needs of young people. UNFPA and development partners launched the Safeguard Young People program to increase access to quality integrated services and information by adolescents and young people in 20 countries in East and Southern Africa. It aims to reach 3 million youth with comprehensive sexuality education and services by 2016. In 2014, the program had already reached over 900,000 young people with integrated HIV and sexual and reproductive health services. More than 4 million condoms were distributed during youth events. In the area of advancing gender equality, UNFPA has been involved in a number of advocacy and capacity building initiatives. In 2014, it supported the launch of the African Union campaign to end child marriage. The campaign has since been launched in 7 countries in East and Southern Africa. UNFPA supported national efforts to remove barriers and bottlenecks to law enforcement and helped implement national strategies and programs. In the same year, UNFPA provided financial support to the Southern African development community through securing the services of a legal drafter for the development of a model law on child marriage. UNFPA supports the work that NGOs, religious and community groups carry out with men and boys to achieve gender equality. Between 2014 and 2015, several regional capacity building activities on gender transformative norms were organized in countries in East and Southern Africa. These were aimed at engaging men and boys in preventing HIV and maternal mortality, fighting gender-based violence, and promoting gender equality and sexual and reproductive health. In addition, UNFPA has conducted human rights trainings and awareness-raising activities with male cultural leaders around female genital mutilation with the aim of increasing their understanding of the harmful consequences of this practice. UNFPA helps countries to prepare, conduct, process and disseminate data from census, surveys and vital registration systems to increase and facilitate better mapping of socio-economic and demographic inequalities. It has partnered with regional institutions and country offices to strengthen national capacity in generating, analyzing and disseminating quality data and information for development. In 2014, UNFPA partnered with the African Institute for Development Policy to help countries analyze their potential for harnessing the demographic dividend, the accelerated economic growth that could result from a growing young population and decreasing fertility rates. In addition, it supported evidence-based advocacy and policy dialogue on the double dividend in many countries in the region. UNFPA provided technical support to the countries in the region that conducted the 2010-2014 round of population and housing census and trained statisticians in the use of mobile devices in census data collection. Several countries in East and Southern Africa have been affected by recurrent natural disasters such as drought in the Horn of Africa and Southern Africa, and severe flooding in Mozambique, Malawi, Madagascar, Namibia, and South Africa. Burundi and South Sudan have faced large humanitarian crises due to conflict. By November 2015, 200,000 Burundians have been displaced by the unrest that broke out in July. South Sudan, the world's youngest country, plunged into crisis in December 2013. Fighting between government troops and rebel factions erupted into conflict that has killed thousands and prompted more than 2.2 million people to flee their homes. In these countries, UNFPA has supported the continued delivery of services by deploying midwives, gynecologists, and gender-based violence specialists, by supplying contraceptives, maternal and newborn medical supplies and post-rape kits, and by training health staff and community health workers.
UNFPA clearly has seen a region that has made progress in many ways. And I think the realization at the end of the Millennium Development Goals that many countries had made progress, but still there was lots to be done, and therefore an unfinished agenda, has really framed how we're going into the Sustainable Development Goals. So the Sustainable Development Goals provides again another opportunity for UNFPA to work with governments to ensure that population issues are integral and central to that. Sexual and reproductive health is now part of an SDG goal that specifically looks at the empowerment and the healthy lifestyle of the population. The issues around gender are central to that. And so I think, again, we have an opportunity in a new agenda that is very transformative, that is very integrated, that centers on human rights, for the work that UNFPA does to again materialize.